With his daily briefing, let's listen in live.
Bonjour à tous.
Good morning, everyone.
Today at sundown marks the beginning of Ramadan. For many Muslim Canadians, the coming month will be different than normal, with iftar online and virtual Friday prayers. But that won't change what this special time is all about: generosity, compassion, and service to others. Across the country, Muslim Canadians are on the front lines of the fight against COVID-19 as nurses, doctors, and essential workers. So thank you, and Ramadan Mubarak.
Today, Canadian Muslims will be marking the beginning of Ramadan. The next month will not unfold as usual, but the values of generosity and compassion that are at the heart of this tradition are more important than ever. Right across this country, Canadian Muslims are on the front lines of the fight against COVID-19. Physicians, nurses, and essential workers. Thank you, and Ramadan Mubarak.
This will be another difficult day for many families and communities across the country. We're all thinking about those in Nova Scotia who are grieving the loss of loved ones, friends, and neighbours. Yesterday, I spoke with the families of some of the people we lost. They shared stories about their loved ones and their dreams and plans. In the face of such tragedy, their strength is remarkable. I spoke also with RCMP members from the area, and on behalf of all Canadians, I thank them for their service. And I spoke with some local mayors as well to express my condolences. For Torontonians, I know it'll be a hard day as well, as we remember the victims of the van attack on Yonge Street 2 years ago. Together we mourn, and together we heal. Because just as Canadians were there for each other 2 years ago, we're there for each other today. Across the country, people are hanging tartan, blue ribbons, and scarves from windows to honor those who died. With acts of kindness and donations, people are standing with families who are grieving. And tomorrow, with the virtual vigil, we will all have the chance to show the people of Nova Scotia that they are not alone.
For people in Nova Scotia, today will be another difficult day. In the face of such a tragedy, they are showing incredible strength. And the citizens of Toronto will also have a difficult day today. Today, we are remembering the victims of the attack on Yonge Street 2 years ago. Together, we are mourning, and together, we will come through this.
These are tough times, but there is reason to hope. When it comes to COVID-19, what we're doing is working. And to continue on the right track, we need to be thinking not just about the next weeks, but about the next months. We need medium-term and long-term solutions. On that front, I can announce today that we're taking another step forward. We're putting in place an additional $1.1 billion for a national medical and research strategy to address COVID-19. This plan has 3 pillars: research on vaccines and other treatments, supports for clinical trials, and expanding national testing and modeling. Let me start with the first pillar on research. Under this plan, we're investing close to $115 million for research into vaccines and treatments being developed in hospitals and universities across the country. This is on top of the funding we've already provided to support vaccine development in Canada. The second pillar of the plan is to make sure that once we have potential vaccines and treatments, we can test a wide range of options. Under this plan, we will invest over $662 million for clinical trials led by Canada. A vaccine is the long-term solution to this virus, but these drugs will take months to develop, test, fabricate, and roll out. So until we have something ready, we need to control the spread of the virus. And that's where the third pillar of this plan comes in. We're investing $350 million to expand national testing and modeling of COVID-19. This includes creating the COVID-19 Immunity Task Force. The task force will operate under the direction of a leadership group which will include Dr. David Naylor, Dr. Catherine Hankins, Dr. Tim Evans, Dr. Teresa Tam, and Dr. Mona Neiner. We are bringing together top health experts and scientists from leading institutions across the country. Canada's best and brightest will be working on serology testing, blood testing, to track and understand immunity to COVID-19. They'll be looking at key questions like how many people beyond those we've already tested have had COVID-19, whether you're immune once you've had it, and if so, how long that lasts. Over 2 years, we will be testing at least 1 million Canadians as a part of this study. The findings of the research will help with everything from rollouts of a potential vaccine to determining which public health measures are most effective going forward. We will get valuable data, including disaggregated data, to understand the impact on vulnerable populations. And we will also leverage new and existing lab capacity for research. The better we understand this virus, its spread, and its impact on different people, the better we can fight it and eventually defeat it. While this vital research is happening, we're also staying focused on what we can do right now to control COVID-19 and get back to normal as soon as possible. Testing is key. We've now reached 20,000 tests daily, almost double where we were earlier this month. But testing must increase even further before we can reopen and restart our normal activities as a country. You've been doing your part by staying home and practicing physical distancing. It's working, and we can't afford to waste this progress. Aujourd'hui,
today, I am announcing that we are introducing a $1.1 billion medical and research strategy to fight COVID-19. The first part of this strategy will deal with vaccines and treatments. We are investing almost $115 million in research on vaccines in hospitals and universities across the country. That can be added to the money we have already allocated to develop vaccines here in Canada. The second part of our strategy is to ensure that once we do have potential vaccines and treatments, we can test various options. So we will be investing almost $662 million in clinical trials. And the third part involves investing in tests to model the disease. We are currently putting in place the COVID-19 Immunity Task Force. This task force will be led by Dr. David Naylor, Dr. Catherine Hankins, Dr. Tim Evans, with the support of Dr. Tam and Dr. Neiner. They will be coordinating blood tests that will help us to trace the virus and better understand how we can develop immunity from COVID-19. The findings of that research will help us to do a number of things, whether it is making a vaccine accessible or determining what public health measures are as efficient as possible. While we're carrying out that vital research, we continue to reflect on what we can do right now to contain COVID-19 and return to a normal life as quickly as possible. But tests are the most important component. We are now conducting almost 20,000 tests a day right across the country, and we continue to increase our testing capacity before life goes back to normal.
We're seeing terrible tragedies in long-term care facilities across the country. This is unacceptable. If you're angry, frustrated, scared, you're right to feel this way. We can do better. We need to do better. Because we are failing our parents, our grandparents, our elders, the greatest generation who built this country. We need to care for them properly. Canadians need to pull together. There have been requests for military assistance by both Ontario and Quebec, which of course we will be answering. Our women and men in uniform will step up with the valor and courage they have always shown. In the short term, we will be there with support so that provinces can get control of this situation. But this is not a long-term solution. In Canada, We shouldn't have soldiers taking care of seniors. Going forward, in the weeks and months to come, we will all have to ask tough questions about how it came to this. We will all have to do more to get through this terrible situation. En ce moment,
right now, we are witnessing terrible tragedies in long-term care homes across the country. That is unacceptable. If you are angry, frustrated, or worried, you have every reason to feel that way. We must do better because we are abandoning our parents, our grandparents, and our elders, members of the greatest generation that built this country. We must look after them as they deserve to be looked after. Quebec and Ontario have asked us for the assistance of the military. And these are requests we will be answering. Our military will be providing assistance as they always do. But this is not a long-term solution. In Canada, our soldiers should not be the ones looking after our seniors. In the coming weeks and the coming months, we will have to take a long, hard look at how we came to this. We will all have to do more to get through this situation, which is absolutely terrible. Everyone is doing their part to get through this period. We're all part of the same team. While we do our part, everyone must do their part. Together, we can get through this, and together, we will come back in full force. Thank you.
Thank you, Prime Minister. We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. First question, Althea Raj, Huffington Post. Line open.
Good morning. Yesterday you said you were going to continue working with the Finance Department and business associations to ensure that small businesses will get the support they need. Many self-employed individuals feel like they have been forgotten. They can't apply for interest-free loans because they have no payroll, and many have thousands of dollars in fixed costs every month, so the CRB changes really do nothing for them. They feel that your government has been more focused on employers and employees, and many face the real possibility of losing their businesses or going bankrupt. So could you tell us what changes you are envisioning for them?
As we said from the very beginning, we worked on measures to help as many people as possible. We brought in targeted measures to help people who'd lost a paycheck, including people who were self-employed. We've moved forward with a wage subsidy that ensures that people who can remain connected to their jobs while receiving 75% of their paycheck, up to $847 a week. We know that these are measures that got out quickly, are getting out quickly, and are broad and are helping millions of Canadians. But we also know that there are people who are falling through the cracks. That is why we continue to work with industry groups, with stakeholders, with MPs and community members across the country who are feeding us challenges and possible solutions. And of course, we are working with an extraordinary public service to deliver those solutions to Canadians.
Follow-up, Althea?
Okay, but that doesn't. Oh, well, that's your answer. Do you regret this patchwork approach regarding the CERB? It's clear that the need is a lot greater than the government anticipated when it drew up the program weeks ago, and I know that there are a number of people in your caucus who argued that it would have been far easier, and it would be far easier to give everyone who's lost income or lost the opportunity to earn income the ability to apply for help and just tax it back from those who perhaps didn't need it as much next year. I mean, did you make the right call, and are you so stuck on this current course of action that you will not deviate from it?
We knew from the very beginning that targeted support to the people who needed it was the best way to do it, and that's why we move forward with the Canada Emergency Response Benefit that has delivered benefits to over 8 million Canadians, why we move forward with the Canada Emergency Wage Subsidy that is ensuring that people can stay connected to their workplace even if they're not actually doing the work anymore, so that we can bounce back quickly. But every step of the way, we've said we will continue to expand. We will continue to fill gaps. We never expected that we'd get it perfect from day one. Indeed, we knew we wouldn't. But we couldn't let the perfect be the enemy of the good. We needed to get things out as best we could, as quickly as we could, to help as many people as possible. And then we continue every day to make further announcements that fill gaps, that explain how we're going to help those people who aren't hit by the broad measures there to help. We will continue to work on making sure that everyone who needs help gets it.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to come back to the announcement you made yesterday on students. Right now, there is a lack of staff in long-term care homes, and they're also concerned about that happening in the agricultural sector. And some people are worried that this will be a disincentive to young people to go and work in sectors that will be opening up soon, such as the retail sector, which doesn't offer very high salaries. What do you think of that? Do you think the generosity of your measures could lead to a lack of appropriate numbers of staff? Well, students need help, and we know that COVID-19 is hitting every generation very hard, so we have to be there to help. We introduced a program that will also develop jobs for young people right across the country, 76,000 new jobs in targeted sectors that will benefit from the help of young people. I know young people, I know the youth of this country, and I know that they will want to be part of the solution. I know that they will want to help and contribute to the economic recovery in their own way. And I think that ensuring that they have the money necessary to cover their rent or pay for their groceries or to be sure to be able to go back to school in the fall is the right thing to do. And we will be working together to ensure that we achieve the necessary recovery. But I won't apologize for supporting our students in these difficult times. And as a sub-question, some observers have been proposing that Ottawa create a program similar to the summer jobs program, but in this case to motivate young people to go and work in the agricultural sector. We know that they don't have enough foreign workers at this point, and they're not necessarily very well-paid jobs either. Do you think that's an interesting idea? And if not, why? Well, every year we see young people who are interested in working in the agricultural industry or going back to the land, and they're a very green generation and very much interested in everything that is organic or agricultural in nature. So I know that there are a lot of young people who will be interested in that, and it'll be new opportunities for them, and we will be creating new incentives to direct them to these important industries. I have very great confidence in our young people, and I know they will want to be part of the solution in the midst of this crisis.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, morning, Prime Minister. I'm wondering, there are a number of U.S. states that are starting to ease restrictions, opening up businesses again, starting as early as tomorrow. I'm wondering if you're concerned about jurisdictions that are so close to Canada easing their restrictions so much, even while in some cases their virus numbers are still going up.
We have strong border measures in place to ensure that we're doing what we need to do to protect Canada. As provinces look at their own situation and how we can move forward on beginning to reopen our economy, I know that their decisions and our decisions will be informed by what is working and what is perhaps not working as well elsewhere in the world. Okay. Je sais que nous allons continuer d'avoir des
I know
mesures
that we
en
will
place
continue
pour
to have measures in place to protect our borders, to ensure that we can ensure the safety and security of all Canadians. I know the provinces and the federal government are reflecting on the different steps in terms of reopening and firing up the economy again. So we'll look at what has worked and what has not worked in other jurisdictions in order to make the right decisions.
Yeah, I'm also wondering about the Federation of Canadian Municipalities is out today with a request for $10 billion in emergency funding because their revenues have fallen so steeply during this crisis. Are you starting to work with municipalities on a package for something like that?
We recognize that levels of government across the country, orders of government across the country are facing distinct challenges. We've had a number of conversations with the provinces on their financial challenges. And as we know, municipalities are governed by the provinces. We will continue to work with the provinces, but we'll also continue to work directly with municipalities to make sure that Canadians get the services they need, get the support they need. Regardless of the orders of government, we all serve the same people, Canadians, and we need to work together to be there for them. Okay. Nous allons toujours travailler pour être là pour les
We will
Canadiens.
always be there for Canadians who need services and support during these difficult times. We respect the province's areas of jurisdiction with respect to the municipalities, and we will continue to work with the provinces on the municipalities issue, and in some cases directly with the municipalities when it's appropriate.
One more question on the phone, please. Operator.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI. À vous.
Good morning, Prime Minister. I'd like to come back to the assistance provided to Quebec in care homes. Are we talking about 1,000 soldiers being sent in, as was requested? And you're talking about lessons to be drawn. With respect to Quebec, what was not done properly in that area? Because for years, we've been talking about problems in these long-term care homes. First of all, with respect to the request for assistance, as we responded positively to the first three requests from Quebec, we will, of course, be responding positively to this one as well. And we are currently working with Quebec to see exactly how we can provide the best possible support. We received that request last evening, so we're working with them now to coordinate the best possible response in terms of numbers and locations. Now, regarding the lessons we have to draw from the current situation, of course, there will be many important questions to look at and find answers to in the coming weeks and months as to how we can better support the seniors of this country. And I think that this crisis has brought home the fact that there are some challenges we will have to meet all together. Follow up? So, as I understand it, you haven't yet set the number of soldiers that will be going in. And a number of days ago, you talked about sending in volunteers and the contribution of the Red Cross. How many additional individuals could come from those groups? Well, I can tell you we will be there to help. People are facing a terrible situation, and we will be there to help Quebec take control of the situation. It's extremely troubling and terribly unfortunate, and we will be there with the military. And we already have 350 military personnel on the ground in long-term care homes across Quebec. We will be sending more, and we will be working with Quebec, and will help with volunteers, with the Red Cross. We will do everything we can, and we'll be there for each other. That's what we do as Canadians. We're there for each other in a crisis, so we will be there this time.
Hi, Prime Minister. Molly Thomas, CTV National News. The race for personal protective supplies allows for a way out of China. It's been 500 days since Canadians Michael Kovrig and Spavor were arbitrarily detained. Are you any closer to getting them released? And when was the last time they had a chance to meet with consular officials?
We have been working extremely diligently on the issue of Michael Spavor and Michael Kovrig, who have been detained for 500 days in China. This is something that we have taken seriously from the very beginning. I can highlight that the Minister of Foreign Affairs spoke to his counterpart, very recently to express our continued concerns and desire to see them released soon. The COVID-19 crisis has the Chinese system in a position of not allowing consular visits, but we have been assured that they are in a facility in a region that is not particularly affected by COVID-19, although we are continuing to press both for more details and for better access.
Also, Prime Minister, we've seen a spike in anti-Asian violence in different parts of our country. In BC, an elderly man with dementia was shoved out of a store by an assailant that brought up remarks about COVID-19. We now have a Conservative leadership candidate that is asking for Dr. Tam to be fired and is accusing her, the WHO and China, of being in cahoots. What is your message to Canadians as they see this?
Intolerance and racism have no place in our country. Canada has succeeded because of our diversity. It is one of our greatest strengths. And the millions of Canadians of all different backgrounds who are working together, many of them on the front lines to help their fellow Canadians, deserve better than this from all of us. We need to continue in our resolve to be an open, welcoming, respectful country. And I think all Canadians expect that of every politician.
Intolerance and racism have no place in Canada, and certainly not in our public discourse. Our country is strong not in spite of those differences, but thanks to those differences. There are people with different histories and backgrounds and origins who are working together, side by side, to fight COVID-19 and to help their loved ones and their fellow citizens. So during these times, we have to unite. We have to come together and not accept intolerance.
Minister Janet Silver, Global News. With one meatpacking plant already closed in Alberta and the NDP in that province calling on 2 more to be shut down, I'm just wondering, what is the federal government doing to protect Canada's food supply from the effects of COVID-19? And are you worried about federal inspectors going into these plants?
We are, of course, very alert to the issue of food supply in Canada. Food security for Canadians is a continued essential priority. We will work with the agricultural industry. We are strengthening processes around the CFIB to ensure both protection for our inspectors and effectiveness in assuring the safety of our food supply and of the conditions in which workers find themselves. We will continue to work with provinces and various jurisdictions to ensure that we are making sure that Canadians get the food that they need.
And in terms of vaccines, you announced earlier funds for vaccine development. I'm wondering if your plan is to have vaccines manufactured here in Canada for Canadians.
We know that developing vaccines is a really important step, and that's why there are brilliant researchers working across the country in coordination and in collaboration with the international community as we all make efforts to develop a vaccine. But once we've developed a vaccine, whether it be in Canada or elsewhere around the world, we're going to need to produce it, and we will see the same kinds of pressures that we're seeing around obtaining PPE around the world to obtain vaccines, which is why part of the investments we're making today is to establish the capacity of developing vaccines and producing vaccines, mass producing vaccines here in Canada. Okay.
Yes, vaccination will be a critical part of our ability to fight COVID-19, and that's why we're investing in research so that Canadians can be part of the research effort to find a vaccine. At the same time, we need to ensure that we can produce those vaccines here in Canada, and that's exactly what we intend to do. Mr. Trudeau, Louis Blouin, Radio-Canada, Quebec is starting to talk about possible reopening of certain regions, and I believe that Saskatchewan will also be unveiling its own plan to do the same. Some people are talking about mid-May to reopening certain businesses. Do you think it's too soon? Do you think the provinces are moving too quickly? Well, I think everyone wants to know when we're going to be able to lift certain restrictions and perhaps return to a semi-normal life. But obviously, until we have an actual vaccine, we cannot talk about a normal life. We can relax certain measures, if appropriate, but while at the same time remaining vigilant and doing a lot of testing. Various provinces are at various stages of the fight against COVID-19, and they will be making appropriate decisions. And at the federal level, we are trying to coordinate and ensure that we are moving forward based on the same shared principles so that we have a common approach to the measures that will be brought into place across the country and the time that they're going to be introduced. Of course, that will vary from province to province.
We know that everyone wants to know when this is going to be over, when we're going to be able to get back to normal life. Well, until we have either a vaccine or significant treatments for COVID-19, we're not going to be able to talk about getting back to normal. But in the coming months, we will be able to loosen a number of the restrictions and rules that we have right now on personal mobility in certain sectors, on the economy. Different provinces are in very different postures related to COVID-19 and will be taking decisions that are appropriate for them. What we're doing at the federal level is attempting to pull together and coordinate all different provinces so that we are working from a similar set of guidelines and principles to ensure that Canadians right across the country are being kept safe as we look to those next steps.
Earlier, you said that we are conducting approximately 20,000 tests a day now, but it's not enough. So what is your target so that we can really start talking about reopening the economy based on testing? Well, Dr. Tam has talked about 50,000 to 60,000 tests a day as an important target. Other people are saying that it could be as much as double that number. I know that we're doing much more now, and that's why we are also increasing our testing and our testing capacity at this time.
Prime Minister Julie Van Dusen, CBC. You've talked about the fact that it's unacceptable what's going on in Canada's seniors' homes. You've also discussed the idea of making sure people make more money in those homes, but that, of course, would be a short-term solution. In terms of a long-term solution, will you be talking to the premiers about putting seniors' homes under the Canada Health Act, which would set national standards and hopefully make sure that seniors don't go through such a terrible ordeal again?
I think there are going to be an awful lot of Canadians asking questions of all their province, all their politicians about what we're going to do to make sure a situation like this could never happen again. What COVID-19 has done has highlighted and brought forward failings in our system, in our country, where the people who take care of our most vulnerable are themselves extremely vulnerable economically. We need to do better, and there will be a lot of conversations that Canadians are going to demand and that politicians will have about what is the best way to ensure that we are properly protecting our elders.
On the issue of the vaccine, which you've said in the past could take a year to 18 months, will we have to wait for a vaccine to hug our family and friends who are outside of our bubble?
The process around reopening, the level of freedom we'll have to visit friends and to work and to go outside will depend on the decisions and the advice that scientists give us around how to keep ourselves safe. We know it may be a long while before a vaccine. There are discussions around treatments for COVID-19 that might work as well as a vaccine. I mean, we've been waiting for and looking for and searching for a vaccine for AIDS for decades now, and it still hasn't come. But there are treatments that mean quality of life for people with HIV have been massively improved. There are different ways of moving through. We will take the best ways we possibly can as we move forward. A vaccine, obviously, arriving soon would be the best solution. But we need to make sure we are exploring all different ways of ensuring that Canadians' quality of life and safety and protection is upheld in the best way we possibly can going forward. Merci beaucoup tout le monde.
Okay, and that is the Prime Minister of Canada giving us his daily brief.
We now join the following program in progress.